Welcome to Children's Hospital of the King's Daughters. Every year, our experienced team of pediatric surgeons, specialists, nurses, and therapists provide care to more than 200,000 children. And this year, your child may be one of our very special patients. Your child has been diagnosed with craniosynostosis, a condition where the bones of the skull grow together prematurely. You may be feeling overwhelmed, confused, and worried about what happens next. But be assured that our experienced team at CHKD will be with you and your child every step of the way.
How's your little guy? You're gonna do a little smile again? Yeah, that's good. Right on cue. Yeah.
A newborn skull is made up of 5 bony plates. The spaces between the plates are called sutures. These sutures are open at birth to accommodate the rapid growth of the brain. By the age of 3, these bones fuse together and the sutures close. Craniosynostosis occurs when one or more of the sutures close too soon. If this happens, the skull cannot expand evenly as the child's brain grows and the skull becomes misshapen. There are several different types of craniosynostosis depending on which sutures become closed and how the shape of the skull is affected. Some common types include sagittal, coronal, metopic, and lambdoid. Rest assured that you did nothing to cause your child's craniosynostosis. There is no known cause for this condition, but there is a solution. At CHKD, we provide treatment and surgical correction to young children each year through our accredited craniofacial program. CHKD's Craniofacial Center is the only pediatric program in the region accredited by the American Cleft Palate Craniofacial Association, or ACPA.
The CHKD Craniofacial Center is, of course, a multi-specialty center that treats this type of condition. We see about 800 patients at the Craniofacial Center for various conditions. Of the patients we see, 30 to 40 are new craniosynostosis cases needing craniofacial reconstruction or surgery.
The craniofacial team includes a variety of pediatric surgeons and specialists who provide each child with the unique combination of services they need.
Well, for the craniofacial team, you have the craniofacial surgeon or plastic surgeon, such as myself, who has training in craniofacial surgery. We have the neurosurgeon, likewise, who's a pediatric neurosurgeon, also well-versed in dealing with craniofacial procedures. We have our clinical coordinator, and then we have our pediatricians and our nurses. We have other specialists like the ENT specialists, the ophthalmologists, orthodontists, dentists, speech therapists, rehabilitation medicine specialists, therapists, psychologists, and the geneticists, among others. It's a very big team.
At CHKD, surgical treatment of craniosynostosis is generally recommended for children to correct the abnormal shape of the skull within the first year of life.
We do plan to do the craniofacial surgery as early as 3 to 6 months of age, depending on the patient's health. That is beneficial because you're taking advantage of the patient's growth and development too.
During the procedure, the surgeons will separate the skull bones that have fused prematurely and reposition them with the help of very tiny plates and screws so they can grow together evenly.
We're talking about correcting the lack of a growth center in someone's skull bone, very visual. So we're correcting a deformity, and that's why we do it. We do these surgeries with a very high degree of safety. Incredibly high degree of safety.
The procedure takes approximately 6 hours, and the child will recover in the hospital for about 4 or 5 days before going home. Even after the surgery is over, the CHKD Craniofacial Center will see your child each year throughout their childhood to monitor their growth and be a resource for your family.
So when Cooper was first diagnosed with metopic craniosynostosis, he was about 5 months old. So obviously, as a little tiny baby, we were scared. We brought home this perfect little baby, and now something was wrong with him. But we were very thankful to be in this area with a resource like CHKD close by, and in our searching, got connected with CHKD and the resources at their hospital, and kind of started the steps to Cooper's procedure and his surgery to correct it.
First impressions are everything, and I think that's something that CHKD just immediately going into it. I mean, we're scared parents. This is uncharted territory, and being able to ask the questions and for them to provide, really answers to the thousands of questions that we had, it just gave us a sense of security.
Meeting with the surgeons just really helped kind of make us feel assured that we were in the right place for Cooper to get the help that he needed, and that made us feel confident in the surgeon's abilities to help fix Cooper's diagnosis of craniosynostosis.
Everyone was so friendly, everyone was so nice, everyone was so welcoming, and I think the biggest thing for me is they were genuinely interested. I think genuine was just kind of the word that sticks out to me. It wasn't a job to them. It was very much like, hey, we're here for you. We want to know about you. We're here for your son that's in this hospital that we're caring for, and that gave us just such a sense of security that it made sleeping at night a whole lot easier.
There's never been anything that we've experienced of any type of side effect or complication from it. Once he healed, he was good to go, like completely back to our normal, loving, sweet Cooper. It was so amazing to us to see how quickly he bounced back from the surgery and how his recovery process was phenomenal. And I've actually, thankfully, I've had the opportunity to talk to a couple of families who, since Cooper's surgery, were starting the process of it. And I was able to confidently, being on the other side, tell them it's going to be okay. If you're going through CHKD for this procedure, you are in one of the best hospitals for this.
We look forward to caring for your child and recognize you as a very important part of your child's care team. If you have any questions, please call us at 757-668-7713 or visit chkd.org.